In the United States, we give a lot of pain medicine. We have so many luxuries and we've come so far, and here we don't have as much.
A team of Utahns travels across the globe on a mission to help children.
Now, these kids were all born with ear deformities. Good for Utah's Jason Nguyen followed the team to Vietnam to see their work firsthand.
It begins with the picture and ends in a world of difference. This is Dr. Scott Thompson's 15th international trip.
Hello.
This time, Dr. Thompson left his home in Davis County, traveling more than 8,000 miles to Vietnam.
Length of fossa triangularis. They're certainly more prevalent, congenital deformities in countries with large populations that maybe have a lot of poor people.
He comes to Hanoi, Vietnam to work at the National Ear, Neck and Throat Hospital. Hundreds are already waiting.
I can see that the American doctor is very good and very nice.
To help you?
Yes, me and many people in Vietnam.
Dr. Thompson travels with his team, Ginger Matkin and Tyler Yates. They perform what is called a microtia surgery on children and young adults, reconstructing the entire ear.
They might just be born with the earlobe or just a little bit of cartilage, and so they're missing all of this other part of the ear. And so it's a surgery where we take cartilage from the chest and we fashion it and shape it and carve it and stitch it until it looks close to a real ear, and then we put it under the skin.
The three are working with the Help Us Give Smiles Foundation, or HUGS for short. The foundation is full of doctors, nurses, anesthesiologists, and aides who volunteer their time performing this difficult surgery. It can take 5 to 7 hours to complete just one. This week's goal is 50 cases.
I am amazed at these kids when they wake up, these are young kids, how brave they are and how stoic they are in dealing with their pain.
Stoic, because this is probably one of the easiest things these children will go through in life.
Some of the countries that I visit, they really are ridiculed, and they have a lower social station because of these problems, and this just helps them to be able to achieve what they want in life, and also to avoid being teased or kind of treated unfairly by those around them.
Some of these children have been kicked out of homes. Their fathers and mothers left them to die because a defect was seen as a stain on the family. It's often the aunts, uncles, or grandparents who step in to help. They risk everything to see these doctors in hopes of a new life.
Feel a sense of responsibility that this is that important to them, and it makes me motivated to come and do it, because obviously it's something that they're willing to give up a lot for.
After surgery, you see something different, a smile. While these patients are only given 200 milligrams of Tylenol to ease the pain, the relief from bullying will be lifelong.
I think it's a lesson to us that many of these kids have very little, but they're still happy, and there's a lot of ways to find happiness just besides having material things.
It can be hard to put into words what this team of medical professionals are doing. They're selecting countries not only to help children, but to teach doctors. Like in Vietnam, the local doctors are learning how to do these difficult surgeries.
So I guess the big question is, do these doctors need any help?
Well, it's interesting. They say if every plastic surgeon gave just 1 week of their time, they could eliminate microtia and it would disappear. So if doctors are interested in helping, well, the need, it's there.
Yeah, and obviously they'll know where to go. Now, I know you have other stories. You were over there for basically a week. What can we expect later this week?
Well, coming up tomorrow, we're going to take a deeper look at HUGS and why Dr. Thompson got involved and how he got involved. Dr. Quintello was a vital organ in this foundation, and he's the one that put this all together. So we're going to look at the National ENT Hospital and talk to them, because they say if it wasn't for HUGS, they wouldn't be where they are today.
All right.
Great.
Well, we certainly look forward to it. Thank you, Jason.